Hello everyone. Today we are going to discuss cardiovascular emergency part 1. We commonly come across with various cardiovascular emergency. One of the most common cardiovascular emergency that we come across in our casualty is hypertension. In this lecture, we will discuss definition, various terms, various stages and normal cutoff value of blood pressure. 1 in every 5 individuals having hypertension are unaware that they are having hypertension, which makes the early diagnosis quite difficult, and people are generally presented in a very late or acute disabling state. So what is the normal value of blood pressure? Normal blood pressure is less than 120 millimeter of mercury systolic blood pressure and less than 80 diastolic blood pressure. It is what is considered as normal. What is hypertension? It is clearly defined as more than 120 SBP or more than 80 diastolic blood pressure. आपको यहाँ पे ये ध्यान रखना है कि नॉर्मल तो हम तभी कंसिडर करते हैं जब एसपीपी और डायस्टोलिक ब्लड प्रेशर दोनों के दोनों नॉर्मल रेंज में हो, लेस देन 120 एंड लेस देन 80. The and word has been clearly underlined over here. And if either of them, either the SBP or DBP is in more than what is expected, then it is defined as hypertension. Let us see the various stages. Pre-hypertension, which is between 120 by 80 to 139 by 89 millimeter of mercury. Stage 1 is 140 by 90 to 159 by 99 millimeter of mercury. And stage 2 is more than 160 by 100 millimeter of mercury. These terms are very carefully have to be staged. The condition has to be staged very carefully because our treatment will vary accordingly. Let us see few other important terms such as primary hypertension. Primary hypertension, it is also known as essential hypertension. There is persistent high blood pressure without non-secondary cause. And it is related to genetic. Secondary hypertension क्या होता है? It is high blood pressure due to known cause such as medicines, endocrine disease, renal diseases and tumor. Hypertensive emergency क्या होता है दोस्तों? It is elevated blood pressure more than 180 by 120 millimeter of mercury without any end organ dysfunction. और hypertensive emergency ये इसके अंदर we have elevated blood pressure with end organ dysfunction. कुछ भी इसमें डिसफंक्शन हो सकता है, ब्रेन, किडनी, नॉर्मली जो कि हम लोग देखते हैं हम लोग, और आगे अपने कैजुअलिटी वगैरह डिपार्टमेंट में अब हम आगे वाले वीडियोस में ये देखेंगे कि इनका कॉज क्या होता है और इसको डायग्नोसिस कैसे करना है और इसका ट्रीटमेंट कैसे करना है.